Ticarcillin.
It is an injectable antibacterial used in combination with the beta-lactamase inhibitor clavulanate potassium, which is the potassium salt of clavulanic acid. For intravenous administration, ticarcillin is derived from the basic penicillin nucleus, 6-amino-penicillinic acid. Indications: septicemia, including bacteremia, caused by beta-lactamase-producing strains of Klebsiella species, E. coli, Staph aureus, or Pseudomonas aeruginosa or other Pseudomonas species. Lower respiratory infections caused by beta-lactamase-producing strains of Staphylococcus aureus, Haemophilus influenza, or Klebsiella species. Skin and skin structure infections caused by beta-lactamase-producing strains of Staphylococcus aureus, Klebsiella species, or E. coli. Urinary tract infections, complicated and uncomplicated, caused by beta-lactamase-producing strains of E. coli, Klebsiella species, Pseudomonas aeruginosa or other Pseudomonas species, Citrobacter species, Enterobacter cloaca, Serratia marcescens, or Staphylococcus aureus. Dosage: each 3.1 gram vial contains sterile ticarcillin disodium equivalent to 3 grams of ticarcillin and sterile clavulanate potassium equivalent to 0.1 gram of clavulanic acid. Antibiotic should be administered by intravenous infusion spread over 30 minutes. Pediatric patients up to 3 months. For patients under 60 kg body weight. Antibiotic is dosed at 50 mg per kilogram per dose based on the ticarcillin component. Antibiotic should be administered as follows. In mild to moderate infections, 200 mg per kilogram per day in divided doses every 6 hours. For severe infections, 300 mg per kilogram per day in divided doses every 4 hours. For patients of 60 kg body weight. For mild to moderate infections, 3.1 grams of antibiotic consisting of 3 grams of ticarcillin and 100 mg of clavulanic acid administered every 6 hours. For severe infections, 3.1 grams to be administered every 4 hours. Dosage for any individual patient must take into consideration the site and severity of infection, the susceptibility of the organisms causing infection, and the status of the patient's host defense mechanisms. Appropriate culture and susceptibility tests should be performed before treatment in order to isolate and identify organisms causing infection and to determine their susceptibility to ticarcillin or clavulanic acid. Special precautions, contraindications, hypersensitivity. Pediatric. The safety and effectiveness of antibiotic have been established in the age group of 3 months to 16 years. Pregnancy. Category B, use only if indicated. Lactation. It is not known whether this drug is excreted in human milk because many drugs are excreted in human milk. Caution should be exercised when antibiotic is administered to a nursing woman. Side effects: mild diarrhea, stomach pain, nausea, vomiting, joint or muscle pain, headache. Injection site reactions like pain, swelling, or burning sensation, and vaginal yeast infection resulting in itching or discharge. Hypersensitivity reactions. Drug interactions. Aminoglycosides, probenecid.